Make it happen. That was what my manager told me 12 years ago. I was going to lead an innovation project to develop a new medical imaging device. We actually already had a portfolio of devices that worked really well, but our mission was to make it even better, whatever it takes. So we developed a device. We launched it back in 2005, got great feedback from the hospitals who were willing to pay extra for the increase in performance. Looking back, I sometimes ask myself, was it worth it? Was the incremental performance improvement, was it worth the increase in cost and complexity? If I were to diagnose where we are today in healthcare in the developed world, it would be this. We have made great progress through innovation, but we've also made it very complex and very expensive. The US and the European Union together spent over $4 trillion on healthcare per year. The US alone doubled its healthcare spending per person just over the last 20 years. But this doubling in healthcare spending did not translate into a doubling of healthcare improvements. For example, life expectancy in the US just over those last 20 years increased about 3.3 years. As we're facing aging population and an increase in lifestyle diseases, the need for healthcare will only increase. We won't be able to afford the healthcare system as we know it today. We'll have to find new ways to keep our system affordable. To get there, we'll have to change our mindset to do more with less. And this is actually where we in the developed world can learn a lot from the countries in the developing world. Due to the resource constraints that they are facing, they have adopted this mindset for a long time. So how can we get there? There are many ways to get there, but I want to share 3 that I believe are vital in healthcare. The first one is about looking for alternatives. We should look for alternative products and solutions that are not only cheaper, but that are as safe and effective as the ones that we have. Take Dr. Wagnis. He's a surgeon who works for a hospital, an advanced teaching hospital in Pune, one of the largest cities in India. Many of his patients cannot afford their surgeries. So he's always looking for solutions to save costs, and even small cost savings would help. One of the instruments that he's using during surgery are scalp clips. Scalp clips keep skin flaps in place while operating, but they're hard to find in India, and they're very expensive. So he's looking for an alternative that functions in the same way. He started using this, binder clips. Sterilized, of course. They cost less than 1/10 than a scalp clip. And what's more is that he found that they were as safe and effective. This small change can save about 5% of an average cost of a surgery in India. Now, why is it that our scalp clip is 10 times as expensive as a simple solution like a binder clip? Have we over-designed them? Here's another example. If we have to treat a skin injury, we typically use iodine-based products. The All Medical Institute in India actually tested an alternative solution, one that even the ancient Egyptians were already using in their time. Honey. Turns out, it's amazing, they've actually found that honey is more effective than iodine in healing such injuries. Here's another alternative that is even cheaper and apparently also very effective. Maggots. Personally, I prefer the honey option, but I mean, if you know that worldwide we're spending about $4 billion on disinfectants and antiseptics, there is opportunity also for potential cost savings here. Just one more quick example. Power drills in healthcare. I know, some hospitals in Uganda are actually using everyday power drills instead of surgical drills for their orthopedic surgeries. They're using a cover that seals off the power drill so that it remains sterile throughout the surgery. Cost, $450 compared to $30,000 for a surgical drill. What else can we do to do more with less in healthcare? It's about keeping it simple. Many of our healthcare products and processes are overly complicated, so we have to look for opportunities to simplify. Take the example of an infant incubator in India. Around the world, each year, an estimated 4 million babies die in the first 4 weeks of their life. But many of these babies could be saved simply by keeping them warm. But a traditional infant incubator costs about $10,000, so many hospitals in India cannot afford to invest in them. One of the manufacturers of such an incubator, GE Healthcare, decided to take a different approach. Rather than asking their R&D center in the US to take out some whistles and bells to reduce the cost, but also the performance, they asked their innovation center in India to completely redesign the device. So the local developers in Bangalore, India, did what they always do. They started from scratch, looked at the basic requirements, and looked for simple solutions to make it work. For example, they replaced a series of sophisticated switches with a simple control panel that is cheaper, but also easier to use, because that control panel only has some color codings, graphic warnings, so very easy to use. They also redesigned the tilting mechanism to make it simpler, but also more robust, so that it can also operate in challenging environments, like a countryside hospital may be in India. In the end, they managed to develop a device for $3,000. That is 70% less than the current device. Today, that device is FDA approved, and it's sold in over 80 countries around the world, including my home country, Belgium. This is a remarkable example of how a different mindset in innovation in healthcare in a developing country can make a difference all around the world, also in the developed world. How can we further apply now this mindset of doing more with less? The third way is about looking right under our noses. And I'm talking about technologies and solutions that we're using in other industries in the developed world, but that we're not leveraging in healthcare, or at least not fully leveraging. Take this technology that is near and dear to my heart, barcodes. I have to admit, they're not very sexy, but they have changed our world since 1974, except in healthcare. For years, I've helped to advance the use of barcodes in hospitals. In my discussions with hospital managers that have implemented those barcodes, it is clear that this technology brings great benefits to their hospitals. It increases the efficiency of their supply chain, and it's also safer for the patient. Still today, for example, 78% of the hospitals in Europe are using patient wristbands without a barcode. Here's the irony. Even if there are barcodes, it doesn't mean that we're using them. I experienced this firsthand earlier this year. I got injured playing my favorite sport, soccer. So they rushed me to this top-notch hospital close to Brussels. As I was being admitted to the hospital, I received a wristband with a barcode. Great, I thought. At least I won't be misidentified and I'll get the right treatment. To my surprise, none of my caregivers scanned the barcode during the 3 days I was there. What's more is, as I was being wheeled to the operating room, my nurse hadn't checked my barcode nor my file, but she still wanted to reassure me that everything was going to be okay. Don't worry, she said, your doctor is a specialist in hand surgery. I was there for foot surgery. Surgeries on the wrong side actually happen more often than you may think. Experts estimate that there are about 40 per week in US hospitals alone. I wasn't one of them, luckily. I met the surgeon the day before, so he knew I was there. But still, the other thing that I noticed with barcodes as I was in the hospital is that none of the medical products were being scanned as I was there. Imagine this would happen in an airport with your luggage. It would be chaos. You may wonder what the impact could be in a hospital if they would use more barcodes. Well, there's an interesting case study from the NHS hospital in Portsmouth in the UK. They implemented barcode technology to better manage their inventories. They could, for example, reduce very expensive inventory in their operating rooms by 20%. But more importantly is that their caregivers could spend more time with patients and less time, because they had to spend less time searching for the right products. In fact, the National Health Service expects they can easily save $1.3 billion in costs per year simply by implementing this technology across English hospitals. So barcode technology is there. It's right under our noses. Who knows what else is there right under our noses? I believe we have a great opportunity to learn from developing countries on how to think differently about innovation in healthcare. By changing our mindset to look for simple solutions that are as safe and effective and that reduce cost. By changing our mindset that more expensive is not always better in healthcare. By changing our mindset to do more with less. Thank you.